A bill approved by the legislature aims to help seniors with mental health needs who are seeking long-term housing. And Nick Reisman joins us here in the studio. So tell us more about this measure.
Hey, good evening, Susan. And that's right. Older people who are also struggling with mental illnesses are also struggling with housing. Now, a measure that's going to be heading to Governor Kathy Hochul's desk is meant to address the problem.
For Steve Klein, finding stable long-term housing for older people who are also living with mental illnesses has been a struggle.
The most important thing is somebody to have safe housing and housing that meets their various needs.
Klein is the executive director of Mohawk Opportunities, a Schenectady-based organization that provides housing support and services for people with severe mental illnesses.
Often it's the difference between being homeless, being actively psychotic, possibly even being dangerous to others.
The group has 4 community residences that provide housing for 34 people. The wait list is 80 people long. Sabrina Barrett, the executive director of the Association for Community Living, says that underscores the statewide need.
Many are coming to us, they were previously homeless or in prison and may not have family or loved ones who can support them.
This month, state lawmakers approved the creation of a task force to address long-term housing for people with mental health needs. Advocates say the disruptions of moving vulnerable people from hospitals to temporary living conditions can harm longevity, especially for older people.
Their only hope is to find a house in community-based mental health housing to help them feel secure, safe, and become independent.
Hochul wants to spend $1 billion in the coming years to address an array of mental health needs in New York. Advocates have been cheered by the funding, but say more help, especially from expanding staffing, is needed.
If we had the staffing that had the credentials and the training, we would be able to provide preventative care, we would be able to meet their medical needs on the spot and treat them before their situation becomes even worse.
State lawmakers approved the creation of this task force unanimously, really highlighting the bipartisan support it's received. Susan?
So this sounds familiar. Did this pass before?
Well, typically what happened last year was we saw the legislature approve a variety of task forces meant to address just really kind of this array of issues. And one of the big concerns that Governor Hochul has actually raised is that these task forces would be done outside of the budget. There'd be a monetary value attached to these. So she vetoed a slew of them. Obviously, state lawmakers are really hoping for a different outcome this year.
Nick Reisman, thank you.